आपने बहुत सारे लोगों को ये बोलते सुना होगा कि थायराइड की वजह से मेरा वजन बढ़ रहा है, पर ये होता क्यों है? वी हैव अ स्मॉल ग्लैंड इन आवर बॉडी विच इज थायराइड एंड इट इज रिस्पॉन्सिबल फॉर रेगुलेटिंग योर हार्मोनल लेवल्स। तो अगर ये थायराइड ग्लैंड ठीक से काम ना करे तो शेडिंग दोज एक्स्ट्रा किलो कैलोरीज कैन नियरली फील इम्पॉसिबल। सो नमस्ते एंड वेलकम एवरीवन टू अनदर एपिसोड ऑफ बियॉन्ड द पिल वेयर हेल्थ मीट्स कन्वर्सेशन। I am your host Dr. Chetna, and in today's episode we will be talking about thyroid and obesity. To simplify this and make us understand this better, joining us today is Dr. M.V Rama Mohan. He is a highly qualified endocrinologist practicing in Nellore with over 10 years of experience in managing hormone related issues. Dr. Mohan also offers comprehensive care tailored to each patient's need. And so let's welcome Doctor today and understand the link between obesity and thyroid. So hello doctor,
Hello.
and welcome to our show which is Beyond the Pill.
Yeah.
And firstly, so a big thank you that you got some time for us to help us
Yeah.
spread this awareness on the topic of thyroid and obesity. So let's start with, how do you feel about being here today?
It's fantastic. First time I'm doing a podcast, and it's nice to meet you. And it's a
Thank you
nice
so
environment
much.
here.
Thank you.
Yeah.
I would really like to know, and I'm sure our viewers also would really like to know, that how was your journey of becoming a doctor? And
Yeah. It's a long journey. So I did my MBBS from Visakhapatnam and MD from Narayana Medical College. It's a general medicine. Then I did my DM endocrinology from prestigious Andhra Medical College. So
okay,
I was out from there 2015. From 2015 for last 10 years, I'm practicing as a consultant endocrinologist and diabetologist at Nellore, so South
okay,
Andhra.
okay,
I have my own clinic and
okay,
I work in Apollo hospitals, and also I'm a visiting consultant in SHAR and ISRO hospitals.
okay. That's
So
your own setup.
no, SHAR is a government setup.
Okay,
Sriharikota, it's a
okay.
rocket.
That's that's
Yeah.
that's amazing.
Yeah, so I worked in three places. I have my own clinic, diabetes and endocrine clinic at Nellore.
Okay,
Apollo, I go every day 2 hours per day. So this is my journey, and I take care of all the hormone issues like diabetes, thyroid,
understood, understood.
and all other issues like related to hormone,
Yeah,
polycystic ovaries, obesity, growth related disorders, bone, hormones. So all these things. So endocrinology is a specialty where we take care of all the hormones, take care of all the metabolism.
so thank you so much for actually clarifying this, because most of the population doesn't know ki what exactly
Yeah,
is endocrinologist as a field.
yeah.
And then there are like diabetes and thyroid related issues has to be seen by
Yes,
endocrinologist
perfect. One more
specifically.
thing I want to highlight is that you ask me who is the best doctor for heart, you say cardiologist.
Yes,
Who is the best doctor for kidney, you say nephrologist. Like
true.
now, who is the best doctor for diabetes? It is endocrinologist. Highest doctor for thyroid disorders, it is like you have to say endocrinologist. So all
Yes,
hormone. So
that is,
the awareness has to be increased, and
yes,
ours is a super specialty branch where we take care of all the hormone related issues.
understood. So, how, I mean, how does your routine look like? What kind of patients do you see
See,
in a regular basis?
most of my patients will be OPD basis, will be like thyroid and diabetes cases.
Okay.
So, and thyroid disease is also increasing rampantly,
Yes.
as big as diabetes now.
Yes.
So, in our society, around 10 to 15 in 100 are thyroid patients, 10 to 15 in 100 are diabetic patients.
Understood.
So our people need more and more awareness about these two disorders, and they have so many myths in the society where all the quacks and all the uh, see where uneducated and
That is true.
non-professional people talk more about science than the professional people. So we need to really take the message to the people where they should know the facts about the disease. My aim is to tell them that see, this is the facts, so you need to accept the facts and you need to go with your specialist doctor.
That is important. That's
Mm,
why, we have also started this program
yeah.
where all the education has to go from the professional and a
Yes, yes.
qualified doctor as well.
See, in these days when I see my WhatsApp or when I see my Instagram, all everybody is a doctor there. Finally they start with some health program, they start with some yoga
Gyan.
something, finally they end up in treating diabetes and thyroid. I don't know how they reach there, but finally they want to treat the disease, which is not their profession.
That is right. That is right.
Yeah.
So that has also become a big problem nowadays, that
Yeah.
people doesn't actually know that the proper treatment has to be done for your diabetes or thyroid and obesity.
Yes.
So, our today's topic is more focused on thyroid and how it is linked to obesity.
Yes, perfect.
So, just to start with the basics, my very first question is that what are the common reasons for unexplained weight gain? Like people doesn't really know ki why are they having this weight gain?
Yeah. See, I'll tell you the truth. To be frank, the commonest reason for weight gain is excess eating. So
Yes.
everybody is busy, food
Hmm.
is available everywhere, so they eat more.
Yes.
So they are not hungry, but they're still eating.
Out of boredom.
Yeah, boredom or something like. For example, from a place where I come from, district headquarter.
Hmm.
So there is no place for the kids or families to go in the weekdays.
Go out like for a
Yeah,
outing.
for
Huh?
them, taking them kids and taking the parents or taking them to a restaurant is a recreation.
Okay.
So what happens there? At the end of the day, they eat more, they spend, and
Okay.
they are
Okay.
getting obesity.
Okay.
So for example, where you have a place to go,
Hmm.
play,
Hmm. Hmm.
go to beach, have spend time, play. So it's not happening in all places. So people think that spending money on food is a recreation or it is a luxury, but
Hmm.
it's not there.
Hmm.
So and having you can see that there is a exponential increase in the food courts.
Okay. Okay.
When I started my career in 2015, if you see, it's around 30 restaurants in Nellore.
Hmm.
Now there are 300. That means
Okay.
that everywhere there is free food available, and
Understood.
people are spending and
Understood.
eating more and getting diseases.
Understood.
So
Understood.
and working less. So everybody, if I tell the patient to go, do you have a habit of going to walk? I'm busy, sir. They say.
We
So
are busy eating.
yeah, not only eating, I'm busy in my work also. I
Okay.
don't have time. Same way, if I ask a woman how much time you have for your, sir, whole of my time is taken care. My family takes off all of my time. I don't have time to go out. And they say that, sir, I do work in my home. Is it not sufficient like an
Yeah.
exercise?
Huh, huh.
But what happens is I tell them that it's like your job. You need to find extra 30 minutes
For
time.
exercise, that is
Yeah,
important. That is
that's
right.
also important. This is the main cause. Then comes a disease.
Yes.
So, like no, you have uncontrolled hypothyroidism,
Hmm.
where your hormone should, for example, a patient has a thyroid gland here.
Hmm.
Everybody has a thyroid gland.
Okay.
It
So you mean to say that there is a link between thyroid and weight gain
Yes,
or body
absolutely.
weight?
Yes,
Okay.
absolutely. I'll tell you the from basics.
Okay.
You have a gland here,
Hmm.
which is like a butterfly shape,
Hmm.
right, a left lobe and right lobe.
Hmm.
It's like it's a petrol tank for your vehicle.
Hmm.
So it gives energy to your body.
Understood.
So all the metabolism,
Hmm.
all your muscle work,
Hmm.
brain work,
Hmm.
everything,
Hmm.
every organ has to work, and every organ needs your thyroid hormone for working.
Understood. Okay.
So that means what happens is
Hmm.
that you have a thyroid gland functioning. If it is working normally, for
Hmm.
example,
Hmm.
you need 150 micrograms per day
Hmm.
approximately
Hmm.
for a 80 kg man
Understood. Huh.
or woman 150. So if it is working 150 full, your metabolism is normal, you don't gain weight. For some other reason, your gland is not functioning properly. It is
Okay.
producing only 100 micrograms of our hormone.
Hmm. Hmm.
Then what happens? Your hormone production is decreased. You
Okay.
have a deficit,
Okay. Thyroid
thyroid hormone
hormone deficit.
deficiency.
Okay.
It is called hypothyroidism. It's
Okay.
not functioning up to the mark. You
Okay.
need 150 micrograms approximately.
Hmm.
You are getting only 100 out of it.
Okay.
The
Okay.
reasons are different.
Hmm.
And there is a deficit of 50.
Hmm.
What we do is, as a hormone doctor, we tend to replace it with a hormone from outside.
Okay.
We're not treating the disease.
You're treating the hormone level. Okay.
So only we are replacing the hormone.
Okay. Okay.
Your body thinks that you have 100 inside, you are taking 50 from outside. I got my 150 for my work today.
Okay. You're just trying to normalize the
Yeah,
mechanism.
metabolism.
Okay.
So patient feels better with 50. So
Hmm.
total 150, he got 150.
Hmm.
So then if you are not taking today, how much will be left with you? Only 100.
Understood.
Tomorrow you are not taking tablet. Again it is only 100. So your deficit is continuing. You
Yes.
get symptoms there.
Understood.
So what happens if thyroid hormone is less in your body? You have water logging with your body. So it's not, you have more and more water in your blood, more and more edema you get.
Hmm.
So you have more weight gain.
Understood.
So and there is a decrease in the metabolism. All the metabolism slows down.
Understood.
You have fatigue. You have what you say. It's like laziness,
Hmm. Hmm.
and you have hair fall. You have dry
Hmm.
skin.
Hmm. Hmm.
All the hypothyroid symptoms will come.
Hmm.
So, but the problem with hypothyroidism is that the symptoms are like no vague symptoms.
Okay.
You can't say definitely. So you have if somebody comes to me, sir, I have laziness, I'm
Yeah.
feeling dull. It's not 100%
Matlab it
hypothyroid.
is not something which
Yeah,
someone can actually notice,
yeah.
you know.
So it unnoticeable and the symptoms overlap with other
Other
diseases.
diseases. Okay,
So
understood.
क्या होता है कि पता नहीं चलता लोगों को, they can't identify from the symptoms.
Okay.
You need to do a test to find out.
Understood. Understood. So,
So if any patient is obese comes to me, young lady with obesity, any person with obesity, more BMI more than 25 to 30, I tend to ask them, please go for a thyroid check because
understood. Understood.
unnoticed hypothyroidism will be there, which is
Could be the
causing you.
reason. Could be the
Yeah,
underlying reason.
yeah,
Okay.
perfect.
Now, sir, people doesn't really understand the big terms which we use, that is
Yeah, yeah,
hypothyroidism and
yeah,
hyperthyroidism.
yes,
All they understand is कि पतला होने वाला thyroid और मोटा होने वाला
yeah,
thyroid.
yeah.
So can you just in really simple terms make
Yeah,
them
bolo.
understand?
See, what happens is that, as I told you now, if you have thyroid hormone is not functioning up to the mark, you have a deficiency. Then you have increase in your. If you are not treating the patient, that patient gets a symptom. So क्या होता है, इसको thyroid अच्छा नहीं बना रहा है, and you have a deficiency, and you are not taking tablets, then वो दुबला बन जाएगा, मोटा बन जाएगा,
मोटा, yeah, put
मोटा,
on. हाँ.
put on weight because of untreated hypothyroidism.
Understood. Understood.
थायराइड अच्छा नहीं बन रहा है इधर, यू आर नॉट टेकिंग थायराइड हार्मोन बाहर से नहीं ले रहे, देन यू हैव ए वेट गेन.
Okay.
That is called hypothyroidism or untreated. For
Understood.
example, every day a patient takes a tablet and his thyroid levels are normal. They won't have any symptoms.
Okay, they want weight gain.
But the diagnosis is hypothyroidism. Every day his hormones are good because we are giving him thyroid replacement.
Medications. Okay.
Medication ले रहा है, अच्छा हो है, there is no symptoms. He is be absolutely normal as us.
So
हमारा
he'll
जैसा.
not gain the weight also.
No.
No?
If your TSH level is between 1 and 4
हाँ.
with a drug, then there is no symptoms. He is absolutely normal as you and me. So क्या होता है कि thyroid hormone उसको disease भी पता नहीं चलता किसी को भी. Only when they gain weight, if they don't take tablets, and they'll have symptoms.
Understood. So what if there's a case that someone is having hypothyroidism and the person is taking medication, and due to the extra dose of medicine they are losing the weight?
या क्या होता है ना, कुछ लोगों को ज़्यादा डोज देते हैं. सी यू नीड 50, अंदर 100 है, बाहर से 50 देना है. इफ आई बाय मिस्टेक सम डॉक्टर गिव्स यू 100,
Yeah.
so your dose becomes baseline becomes 200 हो गया ना.
Understood.
So what happens there, you have a more hormone than required,
The metabolism becomes
more
faster.
faster. So
Okay.
वो उसको हाइपरथायराइडिज्म बोलते हैं.
Okay.
बाहर से टैबलेट लेने वालों को iatrogenic हाइपर बोलते हैं, क्योंकि यू आर क्रिएटिंग ए हायर हार्मोन बिकॉज ऑफ एक्सेस टैबलेट विथ यू.
Understood.
That is called drug induced hyperthyroidism.
So in those cases, the person is actually having hypothyroidism, but then because of the medicines, the bodies.
which is not more than required there ले रहे हैं, तो उसको हाइपर ड्रग इंड्यूस्ड हाइपरथायराइडिज्म बोलते हैं.
Okay.
And for example, if there is a one more disease called hyperthyroidism itself from the thyroid gland. So some patients, maybe 10% of the all thyroid patients will have large swelling of the neck. It is called goiter. And naturally, due to antibodies, वो ज़्यादा बनाता है. That is called Graves hyperthyroidism.
Okay.
So unintentionally, the gland by mistake produces more hormone.
Okay.
That is called hyperthyroidism. For those people, they become lean, they have palpitations, they lose weight,
Okay.
their eyes bulge out. It is called Graves disease. Graves.
Okay.
And they have a large goiter here. They will be having tremors. And in those patients, we give them anti-thyroid drugs.
Anti-thyroid drugs.
हाँ, उसको क्या बोलते हैं, से उसको 150 चाहिए अंदर approximately, पहले से बोल रहा है ना, उसको 250 आ रहा है अंदर से.
Oh, body itself is actually
Making more.
excessively producing.
So I need to cut down that 100, excess 100.
So you give anti-thyroid medication.
Anti-thyroid drugs will go inside the gland and cut down the formation of the thyroid hormone. वो thyroid hormone chain में break लगाएगा.
Understood.
You don't get output.
Understood.
So it will become to 150.
Okay.
So it keeps on going like that. We need to give the anti-thyroid drugs for many years.
Okay.
And if they don't like to take drugs, we'll remove it, the gland, make it 0, and give 150 from outside.
Oh.
That's easy, no?
Replace.
For, replacement. So make it 0, remove the gland, and lifelong replacement.
Okay. So this is the main reason why a person increases or like gains the weight or the weight, I mean, they shed the weight because of the thyroid imbalance.
Yes, perfectly. So,
Now,
thyroid disease is one of the reasons for obesity or one of the reasons for loss of weight.
okay, sole reason. Okay,
Hmm.
understood. Now, when we talk about weight gaining, sometimes people think कि this is also a normal phenomena, like 1-2 kgs बढ़ जाना.
Yeah.
They don't take it seriously, or no one would think कि just because I could be having thyroid, that's why I'm gaining weight. So
Ah,
when does someone need to really know that
they need to go for a test.
they need to know, like what is the alarming sign that
Yeah.
they'll know कि now I need to go to visit a doctor or testing is required
Yeah,
now.
perfect. It's a nice question. क्या होता है ना,
Hmm.
many women
Hmm.
come to me directly, sir, I want to test myself for thyroid. I'm gaining weight. That's a good sign from them. So they want to know क्या हो रहा है मुझे, क्यों weight बढ़ रहा हूँ. लेकिन it is not 100% the thyroid reason everybody gains weight.
Yeah,
But anybody having a weight gain more than 1 to 2 kgs over 6 months
over 6
ah,
months. Okay.
is an alarming weight gain.
Okay.
If I'll ask them, did you change your wardrobe in
Hmm.
last 6 months?
Okay. This is how. Okay.
Have your belt has become tightened for last 6 months?
Understood. Huh.
And आपका शर्ट का size बदल गया है? Or you are unable to do your daily activity because of weight? Are you having any knee pains with because of weight?
Okay.
Like that I ask. This 1 to 2 kilos, more than 1 to 2 kilos for 6 months is a weight gain.
Okay.
Significant weight gain.
Okay.
वो significant weight gain को I'll ask them, assess them what
Hmm.
is the might be the reason. Clinically I have to check the patient.
Okay.
I'll ask them about their lifestyle, about their food habits. Is there any change from 6 months to now?
Okay. Understood. So
So
is this weight gain because of the body holding water, or is it because the
fat,
person
food.
like the appetite has increased, the
Yeah,
person feels hungry now and then?
yeah.
Is it
See,
because of that?
somebody is having more food available, less exercise. So, for example, if you take 500 calories per day, at the end of 1 month, you gain 2 kilos approximately.
No, but then because of the thyroid, the person is feeling more hungry. Is it that way?
No, hungry भी बन सकता है, लेकिन I can't completely say that it is because of thyroid.
Okay.
So, drastic change in the weight, first point, with other clinical symptoms like loss of hair,
Hmm.
dry skin, any swelling in the neck,
These are like the classical
symptoms,
symptoms.
any
Okay.
menstrual irregularities,
Okay, in women, huh?
women, and any growth retardation in a child.
Okay. Okay.
Weight बढ़ रहा है,
Understood.
height नहीं आ रहा है.
Understood. Huh.
And he has like puffiness of face is more with hypothyroid. They have more bulge in the face, like
Hmm.
no
Hmm.
cheeks will be
Hmm.
bulging.
Hmm.
Compared to other body, their
Hmm.
face will be more puffy.
Okay.
That's also important.
That's also the
So
reason.
clinically, I would
Hmm.
like to any obese person coming to you, you need
Hmm.
to do a thyroid test completely to rule out the disease.
Understood.
सबको पता चलेगा thyroid किया, normal आया,
Hmm.
that means your disease is ruled out. Now you have other reasons. First,
Okay.
you have to
Okay.
change your
Okay.
lifestyle.
Hmm.
ऐसा बोलना है.
Okay.
लेकिन you are missing thyroid means it's a major thing.
Correct. So you have to get your thyroid levels checked.
So
Understood.
anybody coming to obesity, any child less than 15 years of age, any age child coming to you, because there is a much more increasing junk food.
Hmm.
There is no physical activity for kids.
Hmm.
So there is from 7 a.m. to 7 p.m. they are in the schools. So there is no physical activity. There are no sports. So every child is becoming more and more obese
I
now.
know.
So childhood obesity is also a major problem.
That is.
And I see these patients with hypothyroidism in childhood is called juvenile hypothyroidism.
Yes.
So
Correct.
it is also increasing. So
Obesity.
any obesity evaluation, first test is you rule
Hmm.
out a thyroid disorder.
So what are these testing options available for
Yes.
thyroid? Like what tests are actually required for assessing thyroid?
See, clinically, patient may be saying I have hypothyroidism, but I need a proof for that. So it is called thyroid profile,
Thyroid profile.
thyroid
Okay.
functioning tests or
Okay.
thyroid profile.
Okay.
We have a TSH,
Yes. Okay.
thyroid stimulating hormone,
Hmm.
where we tend to do a hormone test.
Hmm.
TSH is released from a pituitary gland to stimulate your thyroid to produce hormones.
Understood. Okay.
So you have a normal thyroid functioning,
Hmm.
your TSH will be between 1 and 4, approximate value.
Okay.
You have a hypofunctioning thyroid. Thyroid में कुछ गलत हो गया,
Hmm.
काम नहीं कर रहा है.
Hmm.
Your TSH will start rising. 4 से 5 होगा, 10 होगा, 30 होगा, 40 हो जाएगा. So it is inversely. आपका काम अच्छा नहीं हो रहा है.
Hmm.
It's not functioning properly. Your TSH will go
Understood.
up.
Understood.
मैंने बोला कि हाइपर हो सकता है,
Hmm.
अंदर ज़्यादा
Hmm.
बना रहा है.
Excessively. Yeah.
Excessive hormone is there, your TSH will go down.
Okay.
So it will go to 0.1, 0.2, 0.001, 0.002.
Okay.
So
Understood.
your TSH value is completely opposite to your thyroid function.
Understood.
This is
Understood.
simple logic.
Understood.
So
Okay.
inverse proportion. So a patient comes to you with TSH of 10.
Hmm.
Then what happens? I have to search for his. So why it is 10? It is normal. So अंदर काम अच्छा नहीं कर रहा है, उसको confirm करना है.
Understood.
We have two hormones. It is called thyroid hormones. They are
Understood.
T3 and T4.
Okay.
T3 is a name given to two hormones,
Understood. Okay.
T3 and T4. And in those hormones, we check for the hormones. So T3, T4 and TSH. If your TSH is high, the T3, T4 may be normal or low. Because of the high TSH, your body is maintaining your T3, T4.
Understood.
If you leave the person like that, the T3, T4 will go down and TSH rises more.
Okay.
It is trying to pull up the T3, T4.
Got it. Got it.
So the TSH is trying to pull up the T3, T4 to maintain so that your metabolism is normal.
So if the TSH levels are high, the person needs medication for
Yes,
sure
to make it normal.
to make it normal.
And in
Okay.
hyper में क्या होता है, T3, T4 ज़्यादा हो गया primary,
Hmm.
TSH is suppressed because of high hormones in the body.
Okay. Okay.
So this is the common test. So T3, T4 and TSH.
Understood.
One more antibodies are there. They are called TPO antibodies,
Understood.
thyroid peroxidase antibodies. What we do is that, for example, the reason for your hypothyroidism, why your gland is not functioning properly,
Hmm.
there these antibodies help you. So you have antibodies like a policeman in the body.
Hmm.
They have to fight against virus and bacteria which are coming from outside.
Okay.
By mistake, they are attacking your own thyroid gland.
Of course. Yeah.
So that TPO, thyroid peroxidase enzyme in the thyroid making
Hmm.
chain.
Hmm.
That enzyme has got antibody from your body and that enzyme is gone.
Hmm.
And that means that the production of your thyroid hormone is disrupted.
Understood.
उसको झटका लगा.
So that TPO tells you what exactly and why exactly
So
is this
TPO is
happening.
coming high. It directly tells that because of your autoimmunity, because of your antibodies, your thyroid function has got disturbed. You need to take the medications for the deficiency.
Understood. Okay. Okay. So, sir, earlier you mentioned about a BMR.
Yeah.
So, what are these? What is exactly is this BMR or BMI term which
Yeah.
are being regularly used to assess your obesity and as well thyroid dysfunction assessment also uh, importantly involves all these terms, right?
See, BMI is like, height and weight ratio where you get. If BMI is less than 25, it is normal. 25, 30 is obesity. More than 30 is extreme obesity.
Okay.
So your BMI should be less than 25 for optimal BMI. So
BMI is
body mass index.
index. Okay.
So, and if your BMR is a body metabolic rate,
Okay.
we generally don't calculate that. We don't have any
Okay.
resources.
Okay.
Generally, we say that your body metabolism depends on your hormones.
Okay.
So, if your thyroid is less, your metabolism goes down.
Okay.
Your whole body metabolism comes down.
Okay.
So, in that situation, we need to assess that your body metabolic rate is going down because of your hypothyroidism.
So your BMR goes down, that's why your BMI goes
Yes,
up.
perfectly.
Okay,
Yeah.
it's that way.
Yes.
Inversely proportional to each
Yeah.
other.
So
Okay.
one more issue is about antibodies. For every patient, we don't do antibodies.
Okay.
So because if TSH is more than 10, it confirms that he has permanent damage to thyroid gland. Compulsory antibodies will be positive in most of the 90% of the patients.
Okay. So it's not
The
required.
TSH between 4 and 10 is called early thyroid.
Okay. Okay.
TSH is between 4 and 10 and your thyroid hormone levels are normal. T3, T4 are normal. Where we get a dilemma. It is called early thyroid or subclinical hypothyroidism.
Understood.
In this situation, less than 10, just borderline rise in the TSH, we do antibodies. If antibodies are positive, we tend to treat them early.
With medication, obviously, it's
Same thing.
required. Okay.
So antibodies are done in early hypothyroid patients to detect for the reason.
Okay. So if we do the treatment properly and take the medications properly and if the thyroid levels are normal, obesity or weight gain can be eventually controlled, right?
Definitely, absolutely.
Okay.
So the basic defect because of thyroid is corrected.
Understood.
So that means this thyroid part related to your obesity is corrected, and it won't disturb you.
So now people have these symptoms, just as you mentioned, that they feel fatigued or they feel laziness or tired, and also there is a weight gain along with it. So won't it make difficult for a person to lose their weight because of this fatigueness? They cannot actually exercise
Yes,
properly,
yes,
so they feel that I'm not able to feel healthy and I'm not able to feel active. How
y-
will I exercise then?
yes. See, any patient who is obese, it is very, we have to make them more motivated so that they will work hard to lose the weight. So they'll have inherent laziness or inherent inertia will be there for everybody to go for walking or doing exercise. The most important part in weight management is motivation of the patient and telling them about the real problems with obesity. I tend to tell my kids, about
Hmm.
magnet.
Hmm.
So magnet will attract all the iron. So like a magnet, if you are obese, it will attract all other diseases.
Yes, that is true.
So you need to lose weight to repel them.
Hmm.
So that's how we motivate the patients. So you need to have, like, no, we have many, we have Google Fit, we have, everybody has in watch, electric watch, e-watches. So I tell to my patients, have 7,000 steps per day.
Okay.
From morning waking up to till you sleep,
Okay.
minimum is 7K steps.
Understood.
If you are fully motivated, I want to do 10,000 is perfectly all right. I appreciate you.
Okay.
So minimum is 7K steps per day is a motivation thing for them.
Okay.
Along with your thyroid tablets, you do the 7K steps or averagely 50,000 steps per week.
Okay. So
That is, they get motivated for that. So they'll be very happy, sir. They'll be coming to my OBD and showing, sir, I have done this much steps today.
it's a
So
good idea of
uh,
pushing your patients.
yeah.
So the someone who starts taking this medication, so is it like medication can alone actually help to manage your thyroid, or you have other interventions? I mean, are there other things also which are being required?
See, what happens is thyroid is problem is simple. People make it complicated. So very simple problem. You have a thyroid deficiency, you are giving hormone from outside.
That is
And
true.
people ask me 100 questions, sir, I have to take this lifelong. What happens to me?
Yeah, yeah,
Do I get pregnant of future?
yeah.
Do my kids get
Thyroid,
hypothyroidism in the
understood.
future? The problem is you are taking your tablet, that is a hormone replacement. All hormone replacements are lifelong.
Okay,
Every
you
day your
take it
body
every day.
needs a hormone.
Understood, huh?
See it like a mathematics, I tell them. You have 150, you don't have 50, I'm giving you 50, it becomes 150.
Right.
So like that. And we need to explain them that if you are taking full hormone replacement, you are normal like any other person. You don't have a disease at all, in my opinion.
Correct.
And because of non-treatment or because of late in the treatment, if you are delayed in the treatment, you will get weight gain. For that to correct, it takes time. I tell my patients it may take 3 to 4 months to reduce the weight related to your hypothyroidism. For
Yes.
example, you have a disease which is not diagnosed for 4
Hmm.
months.
Hmm.
You gained around 5 kgs of weight. So for naturally to reduce that weight with the treatment takes 3 to 4 months. Again, you have to do more exercise to maintain that weight loss.
Okay, so that span of time, the
Uh,
3 to 4 months, like the maintenance needs exercise, and
and
I'm sure
yes,
as well diet
yes,
plays a big role,
yes,
right?
perfectly. So diet also, thyroid. There are so many myths about thyroid diets also. We can discuss that also.
Yeah, so coming to the dietary recommendations for both hypothyroidism as well hyperthyroidism.
Yes. So the thing is that thyroid is a hormone where it needs iodine for it functioning. Thyroid hormone structure has an iodine molecule in it.
Okay,
So you need iodine. For example, hemoglobin molecule has an iron in it.
yes,
Iron
understood,
deficiency.
understood.
So you need to have iron rich food, green leafy
Yes,
vegetables
yes,
for your,
yes, yes,
you need to
correct,
have good hemoglobin.
understood.
Like that, anybody coming to you with hypothyroidism, these days it became a fashion to give them non-iodine salt. All the people on Instagram and WhatsApp telling them to eat non-iodine salt.
Oh, yeah,
So that's purely rubbish.
okay,
So why government had made iodinization program in India for last 30 years? The reason is that they have found many hypothyroid cases are iodine deficiency hypothyroidism because there is no adequate iodine available in the food.
okay.
So everybody is getting thyroid disorders. Iodine deficiency is there.
Hmm.
Many thyroid disorders are coming up. So let's make iodination of the food.
Hmm.
So fortification of salt has done,
Okay.
and it has reduced the number of thyroid cases.
That I think this message has to really go
Yeah.
out.
So anybody doesn't take much salt. It is only in micrograms every
Yes.
day iodine. So 2 spoons of 3 spoons of iodized salt is enough for iodine for your whole day. So for the 2 to 3 spoons, you are making so much of noise and nonsense about iodination. If you don't give iodine properly, that remaining thyroid part may go down again. So for the remaining part, no, we are giving only the missed thyroid
Correct,
hormone.
correct.
That remaining gland has to function properly.
Yes.
It needs iodine. So iodine salt is a must for everybody. All black salt,
Hmm.
rock salt, crystal salt, kalluppu we call.
Okay.
Kalla uppu, gadda uppu, like
Understood.
coarse
Hmm.
salt.
Hmm.
And yellow salt, pink salt, Himalayan salt are not supposed to be used.
Not supposed to be used.
Yes.
Okay.
Only iodized salt supposed to be used for anybody in the family, not only
Okay.
hypothyroid patient.
Okay.
And generally, the amount of salt intake should be restricted for everybody.
Huh, obviously, I mean,
And
you
you
need to
don't
have
need
food.
to have a salt over the table. Over the table salt should not be there for any family member.
Right.
Salt used in your cooking is enough for your life.
Okay. Okay. So,
So
are there any specific food which one needs
yeah.
to take?
See, everybody asks me, sir, I have thyroid. I don't want to eat cabbage. I don't want to eat
Broccolis.
cauliflower,
Yeah. Huh.
broccoli,
Huh.
all Brassicaceae family.
Yes. Yes.
And all those things. Can I eat potato, sweet potato like that? See, there is no relation to your food with your thyroid.
No relation. Okay.
Okay. Some patients will have large goiters like this. There will
Hmm.
be swelling from like this. They will be hanging. That is called big goiter. So some foods are goiterogens, they are called. Rarely 1 in 100 will have a goiter.
Okay.
For them, we say you can eat broccoli, cabbage, or everything, cauliflower, but after cooking.
Okay. Don't eat it raw.
Yeah.
Hmm.
So that means how much percent it goes to?
Hmm.
Only 1% or
Understood.
2%
Yeah.
only. So everybody can eat whatever food they want if they have hypothyroidism. So there is no relation with the food.
And what about exercise? Like, are there any specific exercise which will help?
Yeah. So somebody is there, on a yoga teacher is there. Finally, she is saying, you do this yoga, stop your thyroid hormone.
No, this shouldn't be the case.
Yeah, same way.
Yeah.
So your physical activity, your food is not going to change your thyroid hormones.
Okay.
Thyroid hormone is a chemical released from your gland,
Hmm.
which is an independent functioning.
Understood.
So not related to your exercise, diet, or any other stress something.
Okay.
So somebody says, decrease your stress, your thyroid will be more
Hmm.
functioning. No, it won't work like that.
Okay.
So
Okay.
it works for diabetes,
Okay.
not for thyroid.
Okay.
Thyroid is a metabolic hormone where you need to, if your hormone is less, you need to supplement it.
But then what I feel is that it doesn't work for thyroid, but it do work for obesity, which
Ah,
is because of the thyroid.
but
So your
absolutely.
sleep, so your stress,
Yes.
your physical activity, and your diet.
सी ओबेसिटी क्या होता है ओबेसिटी में मल्टी फैक्टरल हो जाएगा
Hmm.
if you talk about obesity if you are depressed you eat more if you don't work you eat more if you are busy also you eat more you tend to decrease your stress so your eating habits your stress your less sleep everything your diabetes uncontrolled diabetes everything goes to obesity again
That is what, no, it's a
ah
cycle. The thyroid,
yeah
that because of that obesity because of,
purely talking about thyroid there is no relation to food.
but then the obesity needs
So
maintenance.
if you are obese, you need
Hmm.
to be happy in changing your lifestyle.
Understood.
You need to be very positive.
Hmm.
Take the all the take down all the points about why you are obese.
Hmm.
So make a list of the things you have to change in your life. Plan accordingly so that all the factors can be reached out. It's not a single factor obesity.
Understood.
So that's how we tend to tell them.
That's what.
So your hypothyroidism untreated is directly related to obesity. If you treat it, that factor is gone. Then comes your eating habit. You have to. Then comes your exercise.
Yes.
Then comes your stress life. So it is called work-life balance.
That is how it is. That is how like your lifestyle
Yes.
modifications and everything is been related to thyroid.
Yes. So if your thyroid is normal, if your thyroid hormones are happy, then half of the work is done.
That is true. That is true. So, what happens if someone who just leaves thyroid without taking the medication or
Um,
without treating it? Like, what long-term effects does it have on body?
See, you have, for example, what happens is it slows down your metabolism and all the load over the organs is increased. In a crude term, load means they have to work more.
Yes, the
at low
workload
energy
increases.
levels.
Okay.
You are driving a car at first gear only.
Yeah.
You're not, you want to
You're
go,
harassing the body.
you want to go in at 90 speed at
Hmm.
first gear,
Yeah.
which is difficult for the body to adjust.
Yes.
So if you have normal thyroid hormone, it will go to automatically it goes to fifth gear.
Yes.
That's how I can relate.
Okay.
So that means that if your thyroid is not corrected,
Hmm.
all the metabolism comes down. You have your kidneys slows down work, your heart slows down, your heart rate comes down. There is a water pulled out around your heart also.
Yes.
So everything, your
Water
muscles
retention.
are becoming cramps. You get cramps. Your muscles are becoming thick, and you can't stand up from sitting position also.
Oh,
It is called myopathy.
yes.
They can't run, they can't stand up from, they have to take support to wake, stand up also. So like that it affects everything in your body. For example, you are a diabetic, you have a hypothyroidism, you are not detected with hypothyroidism, your sugars are also not under control.
Okay.
Uncontrolled diabetes because of hypothyroidism, untreated hypothyroidism, they coexist also.
Coexist. That's why. Okay.
So for every diabetic patient also I need to do thyroid hormone levels every year, so that I am ruling out अच्छा है आपका. If I am treating thyroid, no, that sugars also comes down good.
Okay. Okay.
So
So
that's
that's
how we
like
have
a
to take care
secondary
of thyroid.
cause. Okay.
So it is like, metabolism linked, like, no, like a circles they are linked like. So you can't remove one part.
Understood. So what are the common myths like that people about thyroid and weight gain that people ask when they come to you?
Common myth is, sir, I want to stop this tablet. Is it possible? First, see, you have a problem. I am giving you, telling the answer, but you are not want to listen to that answer, and you are thinking in other terms. See, it is like, as I told you, like mathematics. You have to take care of your hypothyroidism. You need to take lifelong supplementation, which is a small tablet,
Correct.
and dose depends on your weight. Highest level we give is weight into 2.
Okay.
Normally 1.5 into weight is also sufficient.
Okay. Understood.
So 50 micrograms of, or 75 or 100 we give.
Okay.
For every 3 months to 6 months, I ask them to do the thyroid profile
Okay.
and titrate, so that I keep the TSH between 1 and 4.
Okay. Understood.
So if they miss, no, what
Mm,
happens?
mm.
That thyroid hormone goes up again. TSH goes up again. So I had to adjust the doses. So common one more myth is about food, I told you. So they can eat whatever they want to eat. One more myth is about the timing of the
Yes.
tablet.
Yes.
So they need to take tablet as they get up.
Hmm. Hmm.
6 a.m. they can take, 9 a.m. they can take, 8 a.m. they can take. Whenever they get up from the bed, they can take with a glass of water, and they can take water anytime. So milk, coffee, or breakfast or any other food item give minimum 1 hour gap
For better absorption and
absorption.
okay.
And one more thing, you are taking antacids or
Hmm.
calcium or iron, take in the afternoon or evening.
Okay. Not with the thyroid
No.
tablets.
Commonly they take rabeprazole and thyroid same
Yeah.
day.
Yeah. People do that.
So or pantoprazole. They obstruct the absorption.
Okay.
So you need
Understood.
to be careful. So you take that both work in for 24 hours. You take rabeprazole, pantoprazole in the afternoon before lunch.
Understood. Yeah.
That's how we space the
Correct.
drugs.
Correct.
The timing is also. But and one more thing is, if they forget today, they can take 2 tablets tomorrow.
Oh, they can.
They have to.
They have to. Okay.
And if they forget 2 tablets, they can take 3 tablets third day. Not more than that. So that balances, because the half life of that thyroid molecule is 7 days.
Okay. Understood.
To reach the peak, it takes so much of time. It's
Okay.
not like, no, if you take a dolo, your fever comes down within
Yeah.
1 hour.
Yeah.
The thyroid tablet hormone half life is 7 days.
Oh, that's a new
Yeah,
information for me.
yeah, 7 days. So that means you can take, if you miss the tablet, you can take next day also.
Okay.
That half life covers like that.
But don't do that.
No, they can. We are not robots, no. We
Take it
can
every day.
we can forget some days.
That is
If they
true.
forget, they can remember and take 2 tablets next day.
Okay.
That's the
Okay.
commonest thing I tell to my patient. They are happy with that, and nothing will happen to them. And one more thing, on the day of the test also, they have to take tablet and come. Why should they sacrifice the tablet for the test? Test
Understood.
doesn't
Actually,
differ,
it doesn't depend on the medication.
because
Okay.
that's the half life is 7 days. So for last 4 weeks, how they are, that comes in the test, not for one
Oh,
or 2 days.
okay. Okay. That's how it is.
Oh.
So also there is this increase in trend of smoking and alcohol nowadays. So how bad does it impact your thyroid functioning?
Perfectly, smoking is absolutely an enemy to your thyroid gland. So alcohol is also enemy to every organ. So what happens if you are hyperthyroid? If you smoke, the hyperthyroidism goes up. It won't come down. If you hypothyroid and smoke, your metabolism goes down more. So smoking is absolutely not
Recommend,
advised,
yeah, of
or
course.
we tell all the hypothyroid patient to stop it. Alcohol is also not safe for thyroid gland or any other gland, so that they both should be avoided with the patients.
I'm sure that the effectiveness of the tablet also gets affected because of smoking and
Definitely,
alcohol.
definitely.
Okay. So, is there any important message that you would like to give to our viewers? Also, to encourage the family for screening and to take the medication on time, along with lifestyle
Yes.
modifications.
See, who are the persons who are at high risk for hypothyroidism? So all the children who are not growing up to the mark. For example, दो बच्चे हैं, बड़ा भाई छोटा भाई, बड़ा भाई के हाइट से छोटा भाई ज़्यादा हो रहा है. The big brother is not growing compared to,
Understood. Understood.
and लड़की है, वेट गेन हो रहा है, अर्ली मेंसेस आ रहा है और इरेगुलर मेंसेस आ रहा है, go for hypothyroid. Any obese person. So school में 40 people in the class. So topmost obese students, 10 students of highest weight, you have to do thyroid test.
Okay.
For example, you
Hmm.
take in a proportionate way. So like that, and all the women with irregular menstrual cycles, unwanted hair who have, like
Hmm.
it's called polycystic ovary syndrome,
Hmm.
where you have irregular cycles, obesity,
Hmm.
hyperandrogenism or unwanted hair on
Hmm.
the cheeks and the body, like
Hmm.
male
Understood.
pattern hair,
Yes.
and irregular cycles. और अल्ट्रासाउंड में उसको सिस्ट मिल गया देखने में
Hmm.
ओवरीज में. For them, we need to do thyroid. It's a commonest reason for that.
Okay.
And
Understood.
one more thing, all the pregnant women need to be screened, because तब तक किसी ने टेस्ट नहीं किया, प्रेगनेंसी में ज़्यादा आएगा. और
Okay.
all pregnant women, the TSH is not 4, it comes to 3. Little strict
Understood.
होता है.
Okay. Okay.
1 to 3 we keep. And all the newborn babies.
I mean, I would think that's the protocol now. They
Now
do.
it's not there in India till now.
No?
We tend to do. There is no universal newborn
Okay.
screening by government till now.
Okay. Okay.
In other country it is there, because first 2 years of life your thyroid hormone is low. You are becoming mentally retarded.
That is true. But I see that
So
most of the
commonest cause for mental retardation is hypothyroidism.
thyroid. Yes.
So every newborn child, irrespective of their parents having thyroid or not, we need to do
Okay.
thyroid hormone.
Thyroid testing. All right.
One more thing is, any diabetic patient, every year you need to do a thyroid test. Any cardiac patient, any hypertensive patient, you rule out a thyroid disorder.
Okay.
Others, any osteoporosis, any patients with uh, what you say, osteoporosis of the knees or something, you need to do a thyroid test. And one more, old age patients, they have swelling in the neck. Any patient with a goiter, swelling, any nodules anywhere in the neck, you need to do thyroid. So all these are high risk populations, so that you can choose them.
So, sir, I see many women who has this infertility or irregular menses issues because of hypothyroidism. What when it comes to men population, what do you think? I mean, how is the prevalence in men?
Yeah, definitely men also have hypothyroidism. It is an autoimmune problem. So if you have 60 women having hypothyroidism, 40 men will have hypothyroidism.
Okay.
That means that little more prevalence of hypothyroidism in women because of genetics,
Hmm.
and men also do have hypothyroidism.
Okay.
So there is a good prevalence of hypothyroidism. We need to test them also.
Okay. Screening is important, I'm sure.
Important.
So now we have a very small and interesting segment which is called as this or that. So I have few questions and I would give two options for both of them. You have to tell me
Mm,
which one is the right option, all right?
yeah,
So first one is, what is the biggest culprit in thyroid related weight gain? Is it slow metabolism or water retention?
it's slow metabolism.
Okay. What's more common complaint in hypothyroidism, weight gain or fatigue?
So common is fatigue.
Okay.
Then comes the weight gain.
Okay. Which is better for diagnosing thyroid issues, TSH or full thyroid testing?
TSH is enough most of the cases.
Okay. Which is better, intermittent fasting or small frequent meals?
See, both have same results in my opinion. So your daily calorie intake counts more than that. So
Understood.
at the end of the day, if you have intermittent fasting or small frequent feeds or keto diet or any other Mediterranean diet, the all they have same results in
Okay.
weight loss. You need to keep it, maintain that weight
Okay.
loss.
Which is more effective for thyroid related obesity, cardio or strength training?
Strengthen is very important.
Okay. Which is more beneficial for thyroid patients, gluten free or dairy free diet?
They can eat whatever they want. question is wrong.
Okay.
See, gluten sensitive is a separate topic where only some of the patients have gluten sensitivity.
Sensitivity, right.
Like
Understood.
they take chapati, they take wheat, they get diarrhea.
Understood.
That's a
That is a
direct.
different allergy. Okay.
So dairy allergy is also different. They are called lactose intolerance. They are also very less than 1%.
Okay. What has a bigger impact on managing thyroid related weight gain? Medication or lifestyle changes?
Medication
Okay.
along with lifestyle to maintain their weight loss.
So, sir, thank you so much for
Yeah.
joining us today and traveling for us, doing
Yeah.
such a long journey. It was pleasure having you with us.
Yeah, sure. Nice. I had a great discussion with you. I think this will reach the people.
I'm sure.
So the point in is that making this type of health podcast is that we need to tell the truth out to the patients
That is true.
so that they won't fall into the cracks.
Yes. Thanks a lot.
Yeah, thank you. Namaste. Thank you.
सो टू ऑल आवर व्यूअर्स, आज के एपिसोड से हमने ये जाना कि अगर आपको अपना वजन घटाने में दिक्कत हो रही है डिस्पाइट ऑल योर बेस्ट एफर्ट्स, तो इसका रीजन थायराइड भी हो सकता है. सो अंडरस्टैंड दैट डायग्नोसिस मैटर्स, मेडिकेशन हेल्प्स एंड लाइफस्टाइल चेंजेस मेक्स ऑल द डिफरेंस. सो इफ यू फाइंड आवर वीडियोस इन्फॉर्मेटिव, डोंट फॉरगेट टू सब्सक्राइब टू आवर चैनल एंड फॉलो अस ऑन Instagram at Mankan Specialities for more such valuable health discussions. Until then, stay informed, stay healthy.